Hey, it's Brian from Strong Tower. I'm back. We're going to talk about retro walking and how it can help the knees and the low back today, especially the knees. If you find this helpful, please subscribe to the channel if you haven't done that yet. Smash like on the video. And the knees and retro walking. Retro walking just means walking backwards in the research world. They use the term retro, which I find kind of fun and cool. The benefits here with anybody that's had an ACL injury, at least in this study, they found that there was an increase in muscle strength. So muscle strength in the lower limb increases after that injury. They've also found with people with knee osteoarthritis that their disability level decreases, that their pain levels decrease. So really helpful for those with knee osteoarthritis to start getting in some backwards walking. Research supported here. The other study that I want to talk about, this is our demographic really, is a population of elderly women in the study. That's the research term, elderly by the way, not mine. And they found that their balance went up when they did retro walking and their fall injuries decreased when they added in retro walking. So these are a lot of pretty noticeable, noteworthy benefits, and you might be thinking, okay, why is it so good for the knees? And also there's some research on it helping with low back pain too, by the way. That's a different video. So the theory here is that we are doing some really good things specific for the knee joint. One is we're decreasing compression at the patellofemoral joint. So that patellar, the anterior part of the knee, we're decreasing compressive loading or forces when we walk backwards instead of forwards. So that's one benefit. You're getting movement in, you're providing some lubrication and hydration to that joint, increased blood flow, but we're doing it in a way that's not so jarring and compressive. The second thing to think about here is when you walk backwards, your visual system is way different in terms of stimulus than when you're walking forward. So if I didn't know from the camera what was behind me, I didn't know the room I was in, and I were just walking outside going for a walk, always do it in a safe environment, by the way, where you are a little bit familiar with your surroundings or you have actually checked and know you got a clear lane line to walk. But visually, I don't see what's going on as I'm going backwards, right? So the benefit of that is the brain areas responsible, like the visual cortex and frontal eye fields, different areas of the brain are getting less activation or they're being inhibited, while the joint proprioceptors, the receptors that feel your joint, basically awareness of where it is in space, those are getting way more activity and they're communicating with brain areas like the parietal lobe about those maps for like the knee joint, the ankle joint in this case. So better proprioception is another theory about why this works so well for people. And then the last one is vestibular. So your inner ear, we have a part of the inner ear called the otolith organs, and they sense our linear accelerations, either vertical or horizontal. So if I'm always going forward in my car, I'm always walking forward. Maybe you're taking horse and buggy, I don't know, but you're always going forward. I don't know if I've ever actually seen a horse walk backwards, at least not for more than a couple steps. You are going to get activation of your otoliths in the forward line horizontally, all right? But if we don't ever reverse that out, we're leaving neurons underactive. And over time, we know that through disuse, neuronal areas and neuronal pathways can actually degenerate. So your brain typically doesn't like that, doesn't want that. And if we can activate underactive areas, there's often a lot of value there. So the last thing to think about, the inner ear, some of the results that we're getting on the neurologic side, meaning less pain, better balance, because those are outputs of the brain, by the way. We're probably seeing some improvement because we're starting to even out some asymmetries in the vestibular system. So again, hope this video was helpful today. Remember to like it, and remember it helps to know our neurology.